For this video, I'm going to be demonstrating thoracolumbar lateral flexion active range of motion with a goniometer. I got baby bro Michael here along with me to help me demonstrate as my patient. Let's get to it. So, go ahead and flip around for me. I have my patient in a standing neutral stance position. The first thing I'm going to do is palpate and find the correct landmark. So first one I'm going to be looking for is the C7 spinous process. I have little strips of tape here to mark and keep track of each landmark I'll be looking for. So Michael, I'm going to have you look straight down for me. Okay, and up to the ceiling. Perfect. Okay, straight ahead. Good. So look left and look right. Okay, perfect. Straight ahead. So the C7 spinous process is just below C6. C6 is the one that disappears anteriorly when the patient goes into extension. Both C7 and C6 rotate with rotation. So I'm going to stick this piece of tape right over the C7 spinous process. Next landmarks, or the next landmark is going to be the S2 spinous process, and I'm going to use both PSISs to locate that. It's going to be directly in the middle between the two. All right, so I'm going to palpate for his iliac crests. And once I find his iliac crests, I'm going to go follow them all the way down to the end, which is going to be the PSIS. Right about there. Oh, there we go. So right about there, and then right in between the two is going to be his S2. Now I'll put a piece of tape right there. Okay. So with the goniometer, my fulcrum is going to be at the S2 spinous process. The proximal arm is going to be pointed down, perpendicular to the floor, and then distal arm is going to be pointed straight up to his C7 spinous process and they're all going to make a straight line, 180 degrees. So there. All right, Michael, so we're going to bend to the right. I want you to slide your hand straight down the side of your thigh. Good. Okay, hold. And I'll measure right there. Okay, go ahead and relax. So here's what we have. Looks like he has 25 degrees of thoracolumbar lateral flexion, and that's right about normal. Normal range is about 25 to 30 degrees. Some compensatory movements you're going to want to look out for are if the patient bends the knees, rotates the trunk, rotates the hips, or then shifting the hips laterally to assist with their lateral flexion. Next part is trunk flexion manual muscle test. So I'll have my patient lying supine, and this test is mainly testing rectus abdominis. And for this manual muscle test, unlike other MMTs, I'm not providing any resistance. I'm just challenging my patient in different positions. So I'm gonna, again, I'll have my patient in supine. I'll stabilize his thighs down here. And Michael, I want you to put your both hands right behind your neck, okay? And on 3, I want you to try and sit up and clear your shoulder blades off the floor. Ready? 1, 2, 3. Perfect, awesome. Go ahead and relax. All right, so he was able to clear his shoulder blades off the floor. So I would grade that a 5 out of 5. If he scored a 4 out of 5, he wouldn't have been able to clear his shoulder blades off the floor in this position with his hands behind his neck. But the next position I'd have him in is cross-armed. So go ahead. All right, awesome. That's a 4 out of 5. A 3 out of 5 he wouldn't be able to do it cross-armed, but he would be able to clear his shoulder blades coming off, having his arms at his sides, kind of running down his leg here. So let's test that. Perfect. So that'd be a 3. A 2 would be in the same position, but his shoulder blades wouldn't be able to come off the table. You'd still get that contraction. That's okay, you don't have to do it. 1 would be he can't lift his shoulders off the table, but you would be able to see some neck flexor contraction, and you'd be able to palpate the rectus abdominis contracting here. And then grade 0 would be no palpation of the rectus abdominis contraction.